Hello, Assalamu alaikum, guys. My name is Dr. Farooq, as you guys all know. So today our lecture is on the topic of obtundents. ठीक है? I will be starting the dental pharmacology lectures with a series of it. So our first lecture in the dental pharmacology lectures will be obtundents. Okay. So what is obtundents? First of all, we will go through its definition. So the definition is to make the excavation painless. The dentine sensitivity is either diminished or eliminated by some agents. These agents are called obtundants. So basically, what it is doing is it is making the excavation of caries painless, and then dentine desensitivity is either diminished or eliminated. Okay, by using some of the agent. These are called obtundants. Okay, these agents. So, what are the important facts? A good obtundant should not stain the dentine. So, basically, the obtundant you are applying should never stain a dentine. This is the first thing, and should be free from any irritation or pain, and it should not cause any irritation or pain to the patient. Okay, to remove the dentine sensitivity, it should penetrate the dentine sufficiently. So, basically. What we want is we want to remove the dentine sensitivity, so that's why we need to penetrate it sufficiently into the dentine. Okay, so, however, if the obtundant is applied for a long period, it may cause formation of a secondary dentine and the pulp may shrink. So you need should keep this thing in mind. You don't need to apply it for a long period because it may cause the formation of secondary dentine and it may lead to the shrinkage of the pulp. Okay, so keep these three things in mind. Now, coming to the classification according to the mechanism of action. So, first we will classify them according to the mechanism of action. So, these are three: those which paralyze the sensory nerve endings. So, first of all, it is one which paralyze the sensory nerve endings. Okay. Then those which acts by precipitating proteins. Secondly, those which act by precipitating proteins. Okay. And the third one which acts by destroying the nervous tissue. So these are the mechanism of action. They are upon they are classified. Now, so further, which are the agents which paralyze the sensory nerve endings? You should know their names: phenol, camphor, menthol, thymol, cresosote, or olive oil, and benzyl alcohol. So these are the agents which paralyze the sensory nerve endings. Okay, the agents which acts by precipitating the proteins, which are those silver nitrate and zinc chloride. This can come in your MCQ in the exam, so you should know that. Okay, silver nitrate and zinc chloride. Moving on, then we have those which acts by destroying the nervous tissue. Absolute alcohol destroys the nervous tissue, so you should know that. Okay, so these are the three type of the obtundant basis on the basis of the mechanism of action. Okay, ethyl alcohol. So it is 70% solution is used. Okay, it penetrates rapidly but not deeply. This is the thing. It is painless and non-toxic. Okay, it does not cause staining. Okay, it acts by precipitating the proteins. So MCQ can come. You should know that ethyl alcohol acts by precipitating the proteins in the dental tubules. Okay, it allows the alcohol to evaporate and carry out the painless excavation. So this is very much important. So more or less, you should know that when you want to carry out the painless excavation, you need to apply that ethyl alcohol. Okay, benzyl alcohol, due to its local anesthetic agent, it is used as obtundant. Okay, it can either be used alone or in the mixture with chloroform. This is a point you should remember. And ethyl alcohol in proportion of 5:3:2 respectively. Okay, so because of its action of local anesthetic, we are using it as an obtundant agent. Okay, phenol has protoplasmic poisonous nature. Okay, which is responsible for its obtundant action. This is a very important thing you should know. On the application, it causes irritation followed by numbness. Okay, although it acts rapidly, it does not penetrate deeply. It does not change the healthy dentine, but the infected dentine is darkened. You should know that. It may be used alone or in combination with chloroform and in olive oil in proportion of 2:4 to 10 respectively. Its penetrability is increased by combining with the equal parts of potassium hydroxide and glycerine. The mixture will make a paste. Okay. Creostate, creosote, sorry. It is a properties and action are similar to phenol. Okay. The advantage is that penetrability is relatively more. Basically, it penetrates more. Okay. Camphor, thymol, and menthol. These all three are volatile oils. Okay, used as mixture by combining in the proportion of 1:2:1. This mixture has a rapid action and is specifically useful for diet and lean. Okay, sometimes phenol may be used in place of menthol. Okay, This mixture acts initially by stimulating and then paralyzing sensory endings. Okay, clove oil. This is a very much important. Why I am this is, do you mainly use it in home? Okay, paralyze sensory nerve endings after a brief initial stimulation. Okay, eugenol is an active constituent of clove oil. This is an MCU and has similar action. Okay, penetrability of clove oil is increased on prolonged contact. That's a good thing. Non, it is non-irritating. Okay, and it stains dentine yellow. This is a bad side of the thing of clove oil. It stains dentine basically yellow. Okay, zinc chloride. It is an astringent used in concentrated form. Initially causes sharp pain for a brief period, but which is followed by desensitization, acts by precipitating renal proteins and liberating acid. Does not penetrate deeply, and the teeth are not stained. Used for the shallow cervical cavities in the anterior teeth. So you should know that zinc chloride is basically used for the shallow cervical cavities in the anterior teeth. Okay, paraformaldehyde. Basically, it is a product slowly liberates formaldehyde combined with and precipitate proteins. Okay, onset action is very slow. ठीक does not cause pain. Combine with zinc oxide and clove oil or phenol to make a paste. May be incorporated in a cement for temporary filling. ठीक है, तो paraformaldehyde can basically incorporated in a cement for temporary filling. Main drawback is formaldehyde may penetrate the pulp and cause inflammation. So basically, this is the main drawback of paraformaldehyde. Silicon nitrate action is similar to zinc chloride, less painful, available as crystal or solution. Contact with gums should be avoided. Drawbacks: poor penetrability, stains dentine black. So silver nitrate stains dentine black. You should know that, and it contacts with the gums should be avoided. At present, the use of Obtundent has declined due to the availability of local anesthesia, for example, xylocaine for painless extraction. So, in today era and in today type of dentistry, what we use is we use these Obtundent agent very much less, and we have a local anesthesia such as the xylocaine and or lidocaine for the painless excavation of cavities. ठीक है? So thank you very much for listening to this lecture. I hope it's useful for you guys, and please do check it out. Thank you very much. Allah Hafiz.